My name is Tamara Saldana, and I'm the Interim Vice President of Clinic Operations and Compliance at Care for the Kids Foundation. My job entails overseeing the compliance and regulatory department at Care for the Kids Foundation, and what that means is ensuring that patients are receiving safe care, they're receiving quality care. We do infection control and prevention, so making sure that diseases are not being transmitted between patients or between employees and patients, and making sure that we're following all policies and procedures as well as all healthcare laws and regulations. In order for us to provide sedation services at Care for the Kids Foundation, we have to have a national accreditation such as Joint Commission to provide those services. And Joint Commission has hundreds of standards and elements of performance that we have to meet for us to pass that accreditation. So they will come out every 3 years and inspect us, and their mission and vision is to make sure that patients are free from harm, we're providing safe care, as well as we're advocating for our patients. So they'll look through our policies and procedures, through our reports, and actually follow our staff as well as our patients to see if we're providing safe, effective care. The health department and Joint Commission, they will usually show up unannounced and say they're here to inspect us. And so we have to really be ready for them. So our motto here at Care for the Kids Foundation is we are always inspection ready. So we not only meet the standards that are required from the health department or Joint Commission, but we exceed them so that when they do show up on our doorstep, we are prepared and we're not scrambling to make sure that we're following infection control practices or safety practices. We just pride ourselves in doing that every day. Joint Commission is important to us at Care for the Kids Foundation because not only do we want to provide exceptional care and have somebody come in and make sure that we're maintaining that care, but it's important because it is a law in Nevada that in order for us to provide sedation services, we have to have a national accreditation. And so without Joint Commission, we would not be able to provide the sedation services that we are providing today. So that means all of the lumbar punctures, the bone marrows, those would all have to be done in the hospital if they required sedation, and we wouldn't be able to provide those services here. So Joint Commission accreditation is really important to our organization to make sure that our patients have quality of life, that they can go home at the end of the day. They don't have to be admitted to the hospital for a simple procedure. We can do that right in our office. And so it's really important that we maintain that accreditation to provide exceptional care to our patients.